My name is Ifoma Obadike. I am a student nurse practitioner, and I'm going to be doing an assessment on you today. Is that okay if I do this assessment, because I'm going to put it on YouTube so my instructor can grade me? Yes. Sound good? Okay, great. So with this assessment, I wash my hands with water or hand sanitizer. So I'm going to start this assessment with positioning my patient in the right position. Will you lay down for me in a supine position? Yes. So with this patient laying down, I'm going to start by inspecting her chest wall. I am going to be inspecting the chest wall for any wall deformity. I'm looking at her AP ratio, and I'm sitting the patient down, both posterior and anterior. I am looking all over. I'm looking at her respiratory effort. I'm looking at the way the heart is moving, the respiratory movement. I'm looking at the retraction, the accessory muscle, and the breathing. And then I will also count the respiratory rate. So I'm counting the respiratory rate for 1 minute. So I'm going to be looking at my watch for 1 minute. I count it for 1 minute. So with this patient, the respiratory rate is normal, regular, and not labeled. It's not labeled. So, and I also going to be inspecting her nails. I'm inspecting the nails for any clubbing, inspecting both nails. There is no clubbing, and the ones on the feet, there is no clubbing on the nails, which if there is clubbing, it could be a sign of anemia, but she doesn't have any clubbing. I'm also inspecting her lips. I'm inspecting for any crack, any which would be sign of dehydration. So I will also inspect her the finger. While I'm inspecting also for any cyanosis. There is no any of that on her. So inspecting her generally, everything is good. So now that I've finished with inspection, the first thing I'm going to do is the respiratory excursion, which at this point I will want to check the asymmetry. Do you mind if you sit up for me a little bit? Mm-hmm. So I'm looking at the respiratory excursion. This time I'm going to do the tactile ephemeris. So I will ask patient to say 99. So I'm going to do it in the front, and I'm supposed to be hearing the feeling the vibration, and the vibration is supposed to be equal in both areas. So can you say 99 for me? 99. 99. 99. 99. And under normal circumstances, I will have to undress this patient. So this is supposed to be on the bare skin of the patient. But because we are filming, but if it's in a clinical setting and that I have this patient, so I will have to undress her and do this on her bare skin. So just say 99. 99. 99. 99. 99. Sorry, 99. 99. So I'm going to do the back side, and I want you to turn around so that way the camera can pick, my instructor can see what I'm doing. So say 99. 99. 99. 99. Can you, are we seeing the position so my instructor can see it? So just turn around. Okay. So again, let's do it again. 99. 99. 99. Okay. So it is symmetrical. It's equal in both the anterior and the posterior area. So the next test that I will be doing is called the CVA tenderness. So with this CVA tenderness, it's going to be we're testing the kidney. So if the patient reacts to pain when I hit her down here, it's a sign that there could be some kidney infection going on. So I'm going to do that test, and this is the CVA tenderness. tell me if you feel any pain, okay? Any pain or tenderness?
No.
So at this point, patient, it's negative. She did not feel any pain. It is normal. So I'm going to go ahead. The next, I'm going to be percussing my patient. I'm percussing side to side. I'm going to be using the middle finger on the top of the other middle finger. So this, I'm going to percuss on both the all long side field, and I'm percussing both the anterior and the posterior. So I'm going to start with the anterior, then I'm going to go to the posterior, okay? So with this, if you don't mind looking towards the camera, so I'm going to focus. So on the patient who, on the lungs field, I'm supposed to hear the tympanic sound because this, the lungs are filled with air. But when I hit any organ, I will hear a dull sound. Like if I hit like the vertebral bone, I will hear a dull sound. So, so like I said, this is supposed to be done without her clothes on, but patients do not want to take her clothes off. So at this point, because I'm filming it, and she has to leave her clothes on. But without, in a normal clinical situation, this is supposed to be done without clothes. So I'm going to percuss. So you percuss side to side because you are comparing both all sides. So I have percussed the upper, percussed this side, and I've gone right down here. I percuss here. Then I go down here, and I'm going to go back to the posterior lung side. I'm going to start my percussion. So here I'm going to percuss. So I'm percussing in this lung field. I'm supposed to hear tympanic, like I said. So the next thing I'm going to be showing you, I'm going to be explaining to you now, is the diaphragmic excursion. In the diaphragmic excursion, I'm going to percuss one side, and then at this I will have to ask the patient to take a very deep breath. Then by the time I hear a dull side, and then I will mark it. Unfortunately, my patient has some clothes on, so I will start percussing from one side, this side. So I hear some dull. Can you take a deep breath for me? Okay, I'm going to do it again. So let's take a deep breath. Let's do it again. Okay. So I hear some dull sound here, then I mark it over here, and I go to this side. I do the same, ask patient to take a deep breath and hold it. So here I have another dull side, and then I mark it. So, and then I'm going to start again and ask her, then exhale this, and then I percuss again, going upward from where I had the dull sound. Then here I mark it again, and then at this point I need to measure this. The same thing I have to do on this side, ask the patient to exhale, and then I will mark it again where it ends. At this point, I measure the both sides, and they're supposed to be equal. So now I'm going to move to auscultation of my patient. I am going to be auscultating the lung sound in the lungs on all fields, both the anterior and the posterior part of the lungs and the lateral. So I'm going to be listening in all lung sound, and I'm listening for a clear lung sound of any adventitious long sound like wheezing, crackles, or ronchi. So, and like I said earlier, it is better to listen on the patient's skin. Yeah, if this one is open and it's listen here, then I need to go here. Then I need to go on the lateral and the lateral. So sometimes it's also better to start here on the top of the clavicle area. You want to listen, and then here, and then you go down here. Can you turn over a little bit to the camera so that way she can see it better? So I started above the clavicle, then I listened up here, and I went down. To the costal space, in here, and then I'm listening lateral. So that is for the anterior. So I'm going to go to the posterior, and I'm going to listen to all the long sounds also, because I want to compare both the anterior and the posterior to make sure that they are all clear and there is no adventitious sounds. Okay, here, go one. Two. So I've listened. So at this time, I can also, I'm going to be doing a specialty test, which is called egophony. So in egophony, you ask the patient to say E, and what you hear through the stethoscope is going to be A if you suspect any consolidation. And then what is going to be present is going to be A if there is any consolidation. That's what you're going to be hearing in the stethoscope when she says E. Okay? So I'm going to ask you, if you feel the stethoscope, I want you to say E, or keep saying E for me. So here we go. So E, 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 E. So I am able to hear E because there is no consolidation on this patient, but if there is any consolidation, I will be hearing A on the patient. So this brings me to the end of my respiratory examination today. Thank you. You're welcome.